As a boy in about 1884, Gilbreth was interested in the medical profession and witnessed several hundred surgical operations. In 1910, he started intensive studies in hospitals in the United States, Canada, and Germany, including work at the Mayo Clinic. He observed that doctors took more time looking for their instruments than they did in performing the operation itself. Working with the doctors, he came up with a technique which is still being used today. When the doctor was ready for a new instrument, he extended his open hand, palm up, to the nurse and called for the instrument he wanted. He was thus able to keep his eyes focused upon the open incision and therefore reduce operating time significantly. Gilbreth said that at first the doctors were a little hesitant, but that as they realized how he could help them, they became most cooperative. Here you see the doctors and nurses prepare a patient whose stomach is being painted with iodine for the removal of a large tumor, which you will see later. In addition to critical surgery, Gilbreth also studied various medical and hospital skills. He found that doctors, nurses, and technicians seldom used the same methods. He established the best methods for tying sutures, making hospital beds, and so forth. The AMA recognizes these moving picture films of Gilbreth's as being the first movies of surgical operations. His work, of course, was really a method study, rather than from the medical aspect of how the operation must be performed.
We had marvelous cooperation. I feel sure that this was because Frank took plenty of time to enlist the real interest of the people concerned, and also that he had such tremendous enthusiasm that spread to other people. The days just weren't long enough to fit in all the things that he wanted to.
And in case you're concerned, this operation was successful.